Hey Lauren, I'm Alex, an AI recruiter at John Muir Hospital. Thanks for applying for our open position, Ambulatory Oncology and Infusion RN position. I'm excited to learn more about you. To get us started here, can you tell me a bit about yourself and what motivated you to apply to this position?
Hi, Alex. It's really nice to meet you. My name is Lauren. I have been a nurse for about 2 years, and I started on a medical oncology inpatient unit, and then I have been most recently working in an ambulatory infusion oncology clinic. I love oncology. I'm really passionate about the population, and this seems like similar to what I've done and what I love to do. And so I'm really excited about this position. A little more about me. I just moved to San Francisco about a year and a couple months ago. I just got married, so that's really exciting. In my free time, I love to read books. I love to try new restaurants and spend time with my friends.
Thanks for sharing that, Lauren, and congratulations on your recent marriage.
Thank you.
It's great to hear about your background and passion for oncology nursing. Let's dive into some specifics about the role. First off, are you licensed with the California Board of Nursing as a registered nurse?
Yes, I got my California license in, I think, October of last year, so should be good for a while.
Great, thanks for confirming that. Just to clarify, is your California RN license currently active and in good standing?
Yes, it is.
Perfect, that's good to hear. Now, are you currently certified in Basic Life Support, BLS, by the American Heart Association?
Yes.
Great, thanks for confirming that. Let's move on to a more clinical question. What steps do you take to handle and manage acute drug reactions in patients receiving infusion treatments?
This is a great question, something that we deal with a lot. These drugs are obviously really toxic and really strong, have a high risk of reaction. So I really like knowing the medication, being familiar with the medication that I am about to administer, and also knowing the steps for handling a reaction because it can be different depending on the medication and the patient's specific case. I really try to educate the patient on what side effects to look out for and what things that they need to let me know about. I try to make it a really comfortable environment for them so then if they do start feeling anything weird at all, they feel okay to let me know immediately rather than wait it out for a while. I also am really big on my resources. I think it takes a team to handle any clinic, but also specifically handle acute crisis situations. So, knowing who I can ask for help, knowing who my pharmacist is and how they can help me, knowing my doctors, who's going to be there for me, and knowing my medications to give as well is also really helpful.
That's a thoughtful and thorough approach, Lauren. I appreciate how you emphasize patient education and teamwork. Can you walk me through a specific example of a time you managed an acute drug reaction? What steps did you take, and what was the outcome?
Yeah, so I had a patient who was cycle two of getting paclitaxel. The first time she'd had no problems at all. We had taken steps to titrate the drug really well, but the second time she did great for the first 15 minutes, and then the medication was increased per protocol to go a little faster and she started to have a really pretty intense reaction. Her face got really red. She had a hard time breathing, shortness of breath, wheezing, her oxygen dropped. Um, I luckily was right there. She knew my name, she knew to ask me for help, she knew that something was weird. So I quickly went over. I grabbed a couple other nurses who were right next to me and I knew would back me up. One nurse I asked to give couple medications, Benadryl and Solumedrol, to help handle the reaction. I had my MA go and get oxygen for me. I had another person get some vitals. And I also talked the patient through, tried to calm the patient down, had them take deep breaths, and also talked to the family members so they were informed as well in what was going on. It went well. The patient had a reaction actually the next cycle as well, but then by cycle 4, everything's really smooth. We know what to do for this patient and how this patient handles this medication. Now she's been able to do really well with that drug.
That's a great example, Lauren. It sounds like you handled the situation with a lot of composure and teamwork, and it's great to hear the patient was able to continue treatment successfully. Let's shift
Yes.
gears a bit. What strategies do you use to educate patients on what to expect during chemotherapy, including managing side effects?
Um, to educate patients on what to expect during chemotherapy. So a lot of patients come in for their cycle 1, day 1 of chemo, really scared and stressed out. So first of all, I try to establish um, a, a safe, a calm, caring environment for them, so they know that they can trust me and that I have their best interest at heart. I try to be really open-minded and allow them to ask as many questions as they want, know that I'm there for them for this whole day and beyond. Um, I try to assess their health literacy and see where they're at with understanding, and also take into account how they are doing mentally, because it can be really hard to listen to teaching and education when you're just not there mentally. And understandably, they have a lot of things on their mind that day. So printouts are helpful as well, and also educating again and again and again. Really important that they use their resources or know their resources, so then they know who to ask for help. But an individual approach, getting really on their level, talking things through for as long as it takes, is really, really important to me. I want them to feel empowered during their treatment.
That's a really patient-centered approach, Lauren. And I like how you emphasize tailoring education to each individual's needs and mental state. Can you give me an example of a time when you had to educate a patient who was particularly overwhelmed or resistant to the information? How did you handle it, and what was the outcome?
Yes, I had a patient actually in the last couple of weeks that came in by himself, first time chemotherapy. English was not a first language for him. However, he was um, totally fluent, but not a first language. And he was really scared, really nervous. He told me the first thing he said to me when he walked in was, "I'm really scared." And I think that that's a fair place to be in, and it's hard if you don't have a support system for that as well. So I think I tried really hard first to just make some connections, make him feel comfortable, make him laugh a little bit, also help him find his surroundings and understand more so what I was doing. I tried to talk him through all the things that I was doing so he understood. Um, and then once we were in a better place mentally and he had calmed down a little bit, that's when I started going over the teaching, and I told him everything I was doing step by step, and kind of what my day would look like, our day would look like. So he knew what was going on. He was very educated in what the day was going to look like. And then we went through the chemotherapy teaching. We took the time. We took all of the time, um, and had him teach back to me. Had him go over things again and again, ask all of his questions. Um, and also gave him so many papers that he would have so much reading to do when he went home. But he's doing really great. It's continual education every time, but I know that he is comfortable asking me questions, and I know that he knows that I am okay with him asking questions as well. So we just have a really good relationship now where he's able to be safe in that situation and setting.
That's a fantastic example, Lauren. It really shows your ability to connect with patients on a personal level and adapt your approach to meet their needs. It's great to hear how you built trust and provided ongoing support.